A very good afternoon, everyone. Hi, this is Anuj Tiwari. I'm a postdoctoral research associate at Discovery Partners Institute, University of Illinois at Chicago. Today, I'm here to discuss one of my recent research work on optimizing COVID-19 wastewater sampling strategies for large rural regions of Illinois state. But before I discuss my today's poster, let me give you a brief about my project. So from the last 7 months, I'm working with Professor Charlie Catlett on a Chicago wastewater-based epidemiology project. Dr. Catlett is a senior research scientist at DPI, and with a great and diversified team of researchers from the domain of public health, data sciences, life sciences, and engineering, he is leading both Chicago and Illinois COVID-19 wastewater efforts. In Chicago wastewater project, we are sampling all 7 wastewater treatment plants of Cook County. Our experience with the project helps us to understand that wastewater-based epidemiology is an effective tool in the fight against the COVID-19. It provides rapid and non-invasive insights regarding the health of large or targeted population inside the wastewater treatment plant catchment area. However, many public health questions require insight across many communities, such as at the county or at the state level. The state of Illinois is primarily a rural region comprising 58,000 square miles with a population of 16 million. Over half of the Illinois population live within 50 miles of the Chicago city. Outside of the Chicago city, Illinois has 140 cities with a population greater than 10,000 and 1,000 cities with the population less than 10,000. So, to understand and track the infectious disease such as COVID-19 across these communities, a comprehensive wastewater sampling plan would involve 1,000 wastewater treatment plants and a countless private septic systems. So when we were extending our project from Chicago city to the Illinois state, we started thinking about developing a comprehensive COVID-19 wastewater surveillance strategy. A sampling strategy that will not only index the communities as per the impact of the COVID-19 pandemic, but also prioritize social, economical, racial, and rural disparities while making any decision about the COVID-19 wastewater surveillance. As discussed in the first part of the poster, last year in September 2020, we introduced a random forest machine learning based COVID-19 vulnerability index using CDC's 6 themes: socioeconomic status, household composition and disability, minority status and language, housing type and transportation, epidemiological factor, and healthcare system factors. We already know that random forest uses ensemble learning with recursive partitioning to compute non-linear relationship between the input themes in the best possible manner. In order to train our random forest model, we proposed an innovative COVID-19 impact assessment algorithm using homogeneity analysis and temporal trend assessment technique. Trend analysis analyzes the spread and the severity of the pandemic for potential trend, which indicate sign of chronic disease burden. While homogeneity assessment identifies the abrupt changes in the temporal trend, indicating a sign of healthcare system infrastructure and policy impact, means lockdown phases. In the paper, our C19VI index was also compared with CDC CCVI using advanced statistical measure and a machine learning model. In the next step, as shown in the second part of the poster, we refined this COVID-19 vulnerability index in early 2021 with additional demographic, sequencing, and a more innovative Walmart chat information. As you can see in the different maps, we used the CDC Social Vulnerability Index, COVID-19 Community Vulnerability Index, and indigenously developed COVID-19 Vulnerability Index to understand the vulnerability from the different perspective. We further computed trend and homogeneity of zip code level COVID-19 cases dataset to understand the impact of the pandemic and resilience of the community at the zip code level. Considering the role of supermarket in spreading pandemic, we used Walmart location and overlaid them with a trend map to delineate the Walmart shed. Walmart shed is a catchment area of zip codes around a Walmart showing similar trends. We also used the Illinois city population dataset and COVID-19 Restore Illinois regions to develop 2 alternate sampling strategies: the largest 8 population centers within each of the 11 COVID-19 regions and the largest population centers in each of Illinois 102 counties. As shown in the results, when top 1/3 vulnerable counties overlaid on the sequencing details, we can identify those rural counties which are severely suffering from COVID-19 but don't have any genomic sequencing. We further used zip code level trend map and city population dataset to select the city inside these counties. comparative evaluation of our sampling strategy with the largest 8 population centers in the 11 COVID-19 regions and the largest population center in 102 counties describes that both of these approaches focuses on large population centers around Chicagoland and left vast rural area unexamined. While our approach successfully focused on prioritizing the rural communities for wastewater sampling. This study helped us to learn many lessons around wastewater sampling. In large rural regions, like many US states, different wastewater sampling strategies are required for different population densities. If we look at the large urban areas, the sewershed rarely align with the municipal boundaries because they are shared, and the population served by these sewershed is so large that in order to isolate hotspots or resurgence, it is necessary to develop a sampling strategy that isolate and sample sub-sewershed. While in case of lower population density areas, although the sewershed are well defined around small to medium sized community, but the sheer number of such sewer systems require a sampling strategy that balance population coverage with the geographical coverage. We are also in the process of validating our sampling scheme with multiple experiments. In our immediate experiment, we are going to sample additional population centers in selected counties to determine up to what degree the largest population center adequately represents surrounding communities. Thank you. That's all from my part today on wastewater sampling. I truly appreciate your time and patience listening. Please do send me your queries and suggestions. Thank you.